Data and Digital Innovation, or DDI, is a team that covers things from activity-based costing to reporting, data warehouse and developing systems and applications. I was not involved at all in system development here. I was here managing a project, and Adam said to me one Friday morning, "Can you get a vendor in? We need to get something done for Tuesday." I said, "What is it that we need to do?" And he said, "Oh, we need this thing, we're not really sure yet." And I said, "Okay." So I got hold of a vendor, and they arrived at about lunchtime, 1 o'clock on the Friday afternoon, where we discovered that we were about to build something that had to be ready for Tuesday.
How can I describe it best? 72 hours to set up a clinic and a workflow with, I don't know, one's managed a pandemic over 100 years. So I know we've got a few people who've been in the institution for a while, but I don't think anyone had an experience of how to manage a pandemic. We knew that data was going to be crucial and electronic capture was going to be really crucial because information changes. So we kind of sat down as a team, so that's a DDI team and myself, and we said, hey look, the scope is we've got a clinic, we don't know where the clinic's going to be, we don't know what it's going to look like, but we do know at the end of it we're going to be swabbing people and we need to give them the results as soon as possible.
That thing was what is now the COVID-19 digital application. Initially we developed this for the Royal Perth Clinic, and that is where the MVP, a minimum viable product, went live on the Tuesday morning.
So the application was designed to be used easily across a wide variety of devices. These were often not going to be at a hospital. We needed the flexibility to be able to have clinicians on iPads triaging people in line to be able to capture that information and then go through the process as efficiently as possible. It needed to satisfy infection control as well as ensure that we were getting accurate information about these people in an efficient way.
And here's a crucial bit here, because in the first probably 3 or 4 days of running this, we were testing a SMS bot to let people know there were negative results. But whilst we were testing that, we obviously had to call patients up, and quick bit of sums. We've done well over 500,000 negative text messages to patients who've come through our COVID clinics, including at the airports. That's roughly 25,000 hours worth of phone calls we would have had to have made if we didn't have that tech in place.
Once we download all the data, obviously there's a requirement to report this at a state level. So the State Health Incident Command Center, SHIC, as we know them, would access all our products to get the relevant numbers, which were in real time up to the last 10 minutes. So we could get pretty much a pulse on every clinic as to what they've seen in the last 15 minutes and report at a level as required.
Okay. When did you notice the symptoms started for you?
Yesterday morning.
We're actually able to demonstrate we could build a digital workflow really quickly, and it was scalable. So we first utilised it here at Royal Perth Hospital COVID Clinic, and then went out to Armidale Clinic. And then lo and behold, as the pandemic, as you'd expect, has expanded. It's not just confined to a metro region, it's everywhere. All the other HSPs were asking us, is this something that we could utilise? And the answer, of course, was yes, of course, this was for everyone to use.
Since that time, it has been adopted at COVID clinics around the state, and I've gone right around the metro area, including public-private partnerships at Midland and Joondalup, and I have done remote training for Kununurra, Broome, Bunbury, all over the place. I left here at, 11 o'clock one day, drove down to Rockingham because they wanted to start using this product, trained them in the car park, and they went live at 1 o'clock that day. I just had to call the boys and say, can you add the site in please? And we were done. That is how scalable and rapidly evolving it was. And then we started using it at the airport. We used it in hotel quarantine when East Metro was managing hotel quarantine.
This is something which has gone all the way up to the borders up at Kununurra at Eucla. It's used off a 5G dongle. People coming through the borders, transport, freight, logistics, getting swabbed, entering the state. So it's at every corner of WA. Every entry point, this application is being used.
You can't really have any more superlatives about the DDI team. They are very much can-do, and it's always, yes, how can we help you? Not a roadblock or a barrier. They're always about coming to work with you for a solution. They're always about collaboration.
Excellence is, okay, we always strive to do our best in the best possible way, and then obviously look at ways to innovate.
I think in health, there's a lot of excellence around us. People train for a long time to be part of the healthcare industry. To me, I want to be a part of that. I want to make a difference, I want to change, and I want our department to be excellent. We should be able to support these clinicians in the excellent work that they do, and I want us to be the best at being able to do that.
Excellence is also part of what contributes to the East Metro vision of being amazing. You can't have amazing if excellence isn't a stop along the way. It's really hard to answer what does excellence mean to me. It might be that poem up there kind of tells you, do more than belong, participate, do more than care, help, do more than believe, practice, do more than be fair, be kind, do more than give, serve, do more than live, grow, do more than suffer, triumph. It's actually a really good, do more. Don't just stop because you've got to this point. Where can you go from here?